Hi friends and colleagues, my name is Dr. David. Welcome to my drug and health channel. Now today I'll be posting my first video on this channel, and the title of today's video is sexually transmitted drugs or sexual transmission of drugs. Yeah, you heard me well. Sexual transmission of drugs taken by a man is passed to the female partner, or drugs used by female partner is passed to their own man. So that is what we are going to be discussing today. Let me put it to you. Did you know that just like we share happiness, we share gene, even disease during sexual intercourse, do you know that drugs are also being shared? Did you know that drugs are shared through sexual intercourse? So I'm going to be doing the discussion. Just stay put as we go. Please subscribe to my channel so that you will be seeing all my wonderful videos as time goes by, and please like and share. Thank you. So follow me. So sexually transmission of drug can happen in two ways. It can be from female to male or from male to female. In female to male, the drugs may be concentrated in vaginal fluid and is being picked up during intercourse by the male. Or you can have the drug in semen, seminal vesicle, seminal fluids, or prostatic fluids, or the accessory organs in female or male reproductive way. The drug can be found in those fluids and now be shared during sexual intercourse. Is very, very likely. Like talking about vaginal drug, vaginal fluid transfer, you see herbal pastry. Now pastries are dosage forms that are inserted into the vagina to treat one form of condition or the other. So you have herbal pastries, you have estrogen pastry, you have progesterone pastry. Estrogen pastry, they can be used for menopausal syndrome, advanced women that no longer menstruate. You can be placed on this estrogen like Premarin. I don't want to be using brands so that company don't feel offended. So you can use a estrogen pastry. You can use progesterone pastry to the female, just for threatening abortion, some issues surrounding pregnancy. Now even antibiotics, even cancer pills. Now cancer pills can still be taken oral, and it can still have this form of significance in transmission during sexual intercourse. Even gonadotropins, which can come in form of injectables or oral tablets. So these drugs, there's the likely chance that the male partner can take it during sexual intercourse. So also for men on drugs like steroids, antibiotics, antiviral drugs, drug for prostate enlargement, and bodybuilders, there is very a likely chance that they are going to share it. Okay, let me talk about drugs like a drug for prostate enlargement. Now, the specific drug for prostate enlargement is this class of drug that shrink the prostate, the 5-alpha reductase. The drugs like dutasteride, the drugs like finasteride. Now, these drugs, they are even dangerous for women to touch. They can cause all form of abnormality. They can concentrate in semen, and the female partner can pick it up. So these are some of the drugs. Even steroid. I read in Willie Journal that female athletes were tested positive of steroids Mesterolone, letrozole, and Lingandrol. Now, Lingandrol, all these drugs, they are prohibited for sportsmen and women. These women never took this drug, but their boyfriend did, and they were tested positive of this drug. So these drugs, they are easily shared through body fluid during sexual intercourse. Now, talking about the implication, why are we even bothered? Why are we even having this discussion? Now, before we feel that the genital organs like the semen, they are pharmacological sanctuary where you hardly, or disease sanctuary rather, where you hardly find the drug coming to. Like bacteria and virus, they can grow there and drug hardly reach out to them. But newer evidence proved this to be wrong, because today we find out that there are even cells receptor in this area that transport the drugs. There are mechanisms like ion trapping and other mechanisms that concentrate drugs in this area. I won't go detail, we leave this for pharmacology class. So drugs can concentrate in seminal fluid, can concentrate in those specific area where sperm have been produced, the site for spermatogenesis. The same way, drugs that are inserted into the vagina too can still be retained in the wall of vagina, in the epithelium, which aid transfer during intercourse. So many drugs can be retained, or many drugs can, depending on the nature of the molecule, can find their way into this compartment. So drugs that can cause cancer, drugs that can even affect the gene makeup, the DNA. So there is problem of mutation in the cell line, the germ line. I'm talking of the sex chromosome. Drugs like the dutasteride, they cause malformation. Drugs for cancer, many cancer drugs, they cause DNA changes, damages, and even cancer. So there is risk for germline mutation. I'm talking about DNA damage in the sperm and the eggs, the ovum. There's also direct harm on the recipient. For example, I once have a patient that has a reddened penile organ after intercourse with a partner who happened to be using some form of insert, some form of pastry. So there's possibility that the partner can even receive direct harm. We read of anaphylactic shock, anaphylactic reaction. Anaphylaxis is severe reaction to substance or strange thing or drug. Now, a lady is a known sensitive to is a known hypersensitive individual to penicillins. This lady is known to be very hypersensitive to penicillin. She did not take any of the penicillins or beta-lactams, but the husband did, the spouse did. The spouse is on amoxicillin clavulanate, and after oral sex, this woman experienced a serious life-threatening reaction, anaphylaxis. This can only be possible through sexual drug transmission. And again, there is problem of infertility. Now, I mentioned that some group of ladies were tested positive of steroids. Now, Misterolone, for example, is drug they used to treat hypogonadism and low testosterone in men. Now, this drug can be transferred through semen, just like we read in one report. So the lady that is going to be having low dose of this drug is going to be having higher testosterone in their plasma, and this will lead to hyperandrogen. Too much of male sex hormone in female will lead to conditions like acne, hirsutism, that is too much facial hair, and hormonal imbalance, which you can see in form of a polycystic ovary. And these are all things that comes with infertility or subfertility. So there is infertility problem through some drug transfer during intercourse. Then the case can really be serious, as you have in some drug like the one I mentioned before, the 5 alpha reductase, the dutasteroid and the finasteride. Finasteride and dutasteroid. I like to mention the name of the drug, because if I start to call the name of company brands, if I call brands, company might be offended. Now, the 5 alpha reductase, like your dutasteroid and finasteride, they are normally used for alopecia, hair loss in men. They are also used for prostate enlargement in advanced men. Now, about these drugs, they are very dangerous to female, especially of childbearing age. They should not even be touched, and partner on these drugs can pass this drug through semen, and this drug is capable of causing miscarriage, is capable of killing the fetus right in the womb. These molecule can also cause serious malformation, and especially with the male fetus. If the unborn child gender is male, it's very dangerous, because it's even going to cause feminization of this fetus. So these are the dangers of some of these drugs that easily pass through semen. Now, birth defects, just like I mentioned with this 2 drug, dutasteroid and 5 alpha reductase. Then there is danger of doping. Doping is a law in sports that people should not take any form of enhancement, pharmacological enhancement or drug enhancement to perform in sports. But it is possible for somebody to violate doping law unintentionally because of drug transmission through sexual intercourse. I told you, I read a report where 3 athletes of age 20, 21, and 22, each were tested positive for various drugs. I think one is Lingadrol, the other one is Misterolone, the other one is Letrozole. And what happened, their male spouse were on these drugs, and because they had oral sex, anal sex, and vaginal sex with their spouse, they tested positive of this drug, and by default they now violated the anti-doping law. So there's danger of doping, there's danger of birth defects, there's danger of death to the fetus, infertility, and others. There are other things that could associate with this sexual drug transmission. So we are not just to discuss the problem. What should we do? So the best thing to do when you are in some form of treatment is abstinence. Now, I mentioned here that one of the drugs that can be transmitted from men to women is ribavirin through semen. Antiviral drugs. This antiviral drug, you have drugs for HIV like tenofovir, didanosine. These things are found in semen. But I want to talk about a special one, ribavirin. Now, ribavirin is drug for Lassa virus. Lassa virus is the one that causes Lassa fever, and it's very common in Nigeria. It's always I think we can say we are endemic area for this virus, Lassa virus, and the outbreak is usually in the every year. Now, the Lassa virus is treated with ribavirin, and this ribavirin it's known to cause damage to the fetus. It knows to cause stillbirth, miscarriage, and even malformation. So, abstinence is advised for a couple undergoing whose partner is undergoing this form of treatment. The guideline is to abstain or use a serious contraceptive within the period of treatment and 7 months after treatment. If you are on ribavirin, you have to take note of that. You have to use serious contraception and make sure you continue 7 months after treatment. Then the use of condom is highly advised. Then where condom is not helpful, like for oral sex, they have to restraining from oral sex. So reliable contraceptive method of abstinence or use of condom. Then if I think these are the things information I have for you for now. If there's any other thing, I'm going to update this note. So this is the evidence we have now that drugs can actually be transmitted through sexual intercourse. So thank you for your time. Please do well to send your feedback and question. Please remember to like, share, and subscribe to our channel so that you always see our videos. Thank you.